Question of the Week from the Naked Scientists.
Hello and welcome to Question of the Week. I'm James Titko. Today's question comes in from Leonard. I'd like to know about this Lyme disease and how it is acquired and the diagnosis. Thanks, Leonard. Lyme disease is caused by infection with a bacteria known as Borrelia. This parasite can travel through the bloodstream to many parts of our bodies, triggering immune responses and thus a range of symptoms, including skin rashes, fevers, potentially even neurological damage, and more. So how does it get into humans in the first place? Here's Jack Lambert, professor and consultant in infectious diseases at the Mater Misericordiae University Hospital at University College Dublin.
To the best of our understanding, you only acquire it from a tick bite. Certain ticks are carrying the Lyme bacteria, and when they bite you, they inoculate into your blood and you develop a bacterial infection called Borrelia burgdorferi, commonly known as Lyme disease. Some of the people get a rash around the site of the bite, and that's the classic bullseye rash. Once the bacteria enters through the skin, it gets into the bloodstream and it goes everywhere. So it can present weeks to months after the inoculum as joint pain, cardiac problems, tachycardias, brain problems, nerve problems. It kind of affects almost every tissue of the body. Even studies have shown up to a year after the original bite.
As many as 5% of ticks in the UK test positive for Borrelia, this remarkable, albeit pernicious bacterium, which has the ability to proliferate in ticks, mice, deer, our pets, and of course us. It makes humans sick by triggering an immune response and subsequently inflammation in many parts of the body. And it's the varied nature of these symptoms which complicate the next part of your question, Leonard, on diagnosis. But Jack believes there are other factors at play too.
The issue is that I think in the UK and Ireland, people are led to believe it's a rare disease, In Ireland, they don't keep track of it, so they can make any numbers up. So say there's 100 cases a year. I think there's 2,500. The practitioners, it's not on their radar screen. That's number one. But the next challenge is the testing is imperfect. So I would say the standard tests that are used by the NHS in Ireland are about 50-50 accurate. So I have people say, oh, we did a Lyme test. You can't have Lyme. The test is negative. Well, it's not a PCR test. It's an antibody test. And there's lots of reasons for this. But the antibody test, in my opinion, is only about 50% sensitive, the standard test that's done in the UK and Ireland. So you can have a tick bite, be sick as anything, and have a negative Lyme test. It's Lyme disease. You can have a positive Lyme antibody test from a bite you had 10 years ago. It can stay positive. It's your immunological memory, be perfectly healthy, and you don't have Lyme disease. Additionally, if you get the classic rash following a tick bite, that means the infection's already in your body, going into your bloodstream. You don't need to wait for an antibody test. You just treat right away.
So, Leonard, Lyme disease is acquired by tick bites, which transfer the Borrelia bacteria into our bloodstream. Challenges in diagnosing this disease include the many different symptoms, the imperfect testing, and perhaps a spot of bias in the medical community as to how common Lyme disease really is. If you have a bullseye rash, you should go to your doctor, who should start treating for Lyme disease straight away. Thanks to Jack Lambert, professor and consultant in infectious diseases at the Mater Misericordiae University Hospital, and to you, Leonard, for that question. Next time, we'll be answering this one from listener Laurie.
If we can put small nuclear reactors on submarines and Mars rovers, why can't those small nuclear reactors be used along with sustainables to power our towns and cities? Thank you.
Thanks, Laurie. If you have any thoughts, why not join in on the forum discussion on this and all of our other questions on nakedscientists.com/forum. And be sure, of course, to drop us a line with your own questions to chris@thenakedscientists.com, and you could feature on a future Question of the Week. Until next time, from me, James Titko, thanks for listening, and goodbye.
Question of the Week is part of the Naked Scientists podcast. Look us up online at nakedscientists.com.